A hysterectomy is an operation to remove the uterus. Total abdominal hysterectomy, corpus and cervix, with or without removal of tube, S, with or without removal of ovary, S. Through a horizontal incision just within the pubic hairline, the physician removes the uterus including the cervix and may elect to remove one or both of the ovaries and one or both of the fallopian tubes, salpingo-oophorectomy. The supporting pedicles containing the tubes, ligaments, and arteries are clamped and cut free. The uterus and cervix are removed along with a narrow rim or cuff of vaginal lining. The vaginal defect may be left open for drainage. The abdominal incision is closed by suturing. Total abdominal hysterectomy, corpus and cervix, with or without removal of tube, S, with or without removal of ovary, S, with colpourethrocystopex, e.g., Marshall-Marchetti-Krantz, Birch. The bladder neck is suspended by placing sutures through the tissue surrounding the urethra and into the back of the symphysis pubis. The sutures are pulled tight so that the tissues are tacked to the symphysis pubis and the urethra is moved forward. The abdominal incision is closed by suturing. Supracervical abdominal hysterectomy, subtotal hysterectomy, with or without removal of tube, S, with or without removal of ovary, S. The uterus is cut free from the cervix, leaving the cervix still attached to the vagina. The abdominal incision is closed by suturing. Total abdominal hysterectomy, including partial vaginectomy, with para-aortic and pelvic lymph node sampling, with or without removal of tube, S, with or without removal of ovary, S. A biopsy is taken of the para-aortic and pelvic lymph nodes. The physician may elect to remove one or both of the ovaries and one or both of the fallopian tubes. The abdominal incision is closed by suturing. Radical abdominal hysterectomy, with bilateral total pelvic lymphadenectomy and para-aortic lymph node sampling, biopsy, with or without removal of tube, S, with or without removal of ovary, S. The physician may elect to remove one or both of the ovaries and one or both of the fallopian tubes. The abdominal incision is closed by suturing. The physician may remove one or both of the ovaries and one or both of the fallopian tubes. The physician removes the bladder and diverts urine flow by transplanting the ureters to the skin or colon. The rectum and part of the colon may be removed and an artificial abdominal opening in the skin surface created for waste, colostomy. The abdominal incision is closed by suturing. Vaginal hysterectomy method. An incision is made around the cervix through the full thickness of the vaginal membrane. The cut vaginal edge is pulled toward the lower cervix and vaginal dissection is continued with counter-traction. The posterior peritoneum is opened to admit a finger examination of the pelvis. The uterosacral ligaments are clamped and possibly shortened, cut from the uterus, and secured to the vagina. The vesico-vaginal space is entered. The connective tissue fusing the bladder and vagina is dissected and the bladder is separated from the cervix. The bladder pillars are clamped, cut, and ligated near their cervical attachments, as well as the cardinal ligament tissue on each side of the cervix and the left and right uterine vessels. The physician clamps, cuts, and ligates the upper cardinal and lower broad ligament complex. Traction applied to the cervix moves the uterus down until the fundus is low in the pelvis. Hemostats are applied to the angle of the uterus on each side and the uterus is removed. Vaginal hysterectomy for uterus, 250 grams or less. Greater than 250 grams. The myometrium may be incised circumferentially parallel to the uterine cavity axis and removed, or the uterus can be dissected and removed 1/2 at a time. The peritoneum is closed with purse string sutures that incorporate the proximal part of the uterosacral ligaments. Vaginal hysterectomy, for uterus, with removal of tube, S, and / or ovary, S, 250 grams or less. Greater than 250 grams. After the uterus is exteriorized, care is taken to ensure ligation of the ovarian vessels. The ovary is excised under direct vision. For removal of both tubes and ovaries, the round ligament on one side at a time is clamped and divided. A tunnel is made through the layers of the uterine broad ligament that enclose the tube and ovary are clamped together. The structure is pulled forward, the two sheets of the broad ligament are each cut, and the broad ligament is opened completely. The whole specimen is separated from its attaching ligament, which is clamped, and the tube and ovary on that side are removed. The peritoneal and vaginal wall incisions of the hysterectomy procedure are closed. Vaginal hysterectomy, for uterus, with removal of tube, S, and / or ovary, S, with repair of enterocele, 250 grams or less. Greater than 250 grams. The hernia sac is bluntly and sharply dissected from the surrounding connective tissue, excised and ligated, and the surrounding tissues are strengthened and sutured. Vaginal hysterectomy, for uterus, with colpourethrocystopexy, Marshall-Marchetti-Krantz type, Pereira type, with or without endoscopic control, greater than 250 grams. 250 grams or less. After the uterus has been exteriorized and the bladder and urethra separated from surrounding structures, the physician lifts the vagina upward, suspends the bladder neck and urethra by placing sutures through the fibromuscular wall of the vagina lateral to the tissue surrounding the urethra. And sutures the tissue to the symphysis pubis, the midline junction of the pubic bones at the front. An endoscope may be placed to ensure no sutures pass through the lining of the bladder and to evaluate ureteral patency. The sutures are pulled tight to tack the structures to the pubic bone and provide support. Vaginal hysterectomy, for uterus, with repair of enterocele, 250 grams or less. Greater than 250 grams. The hernia sac is bluntly and sharply dissected from the surrounding connective tissue, excised and ligated, and the surrounding tissues are strengthened and sutured. The peritoneum is closed with purse string sutures that incorporate the proximal part of the uterosacral ligaments. Vaginal hysterectomy, with total or partial vaginectomy. With repair of enterocele. The vagina is everted out through its opening and totally or partially removed in sections by blunt and sharp dissection. Any remaining vaginal tissue and the supporting tissues are inverted back into the resulting defect and are sutured in place with total vaginectomy, obliterating the space. Report 58,280. If the physician also repairs an enterocele, a herniation of intestine protruding through the vaginal wall. The hernia sac is bluntly and sharply dissected from the surrounding connective tissue, excised and ligated, and the surrounding tissues are strengthened and sutured. The peritoneum is closed with purse string sutures that incorporate the proximal part of the uterosacral ligaments. Vaginal hysterectomy, radical, Shida-type operation. The physician performs a radical vaginal hysterectomy. This includes the uterus, its surrounding tissues, and the pelvic lymph nodes. The physician also removes the surrounding tissues, including part or all of the vagina and the pelvic lymph nodes. Any incisions are closed by suturing.